I was invited today to come and kind of speak about the role of the CLSC in the aging population. And first of all, I'd like to go back and see what a CLSC is. And it's a local community service center, so Centre de Local Service Communautaire. And it's there to provide free health and social services for the members of the territory where you reside. Like my colleague, Mrs. Doiron, was saying a bit before, the Montreal area is divided by 5 CISSS, where depending on where you live, you will be taken care of by your local CISSS. And at the CLSC, we provide first-line services free of charge, so covered by the RAMQ for the population of that territory. Okay, so services that are usually provided at the CLSC, we're talking about primary health care, so medical, nursing, consultation, either checkup, vaccination, follow-up for common illnesses, screening, prevention, healthcare education. So all those campaigns for, let's say, the flu season or COVID or whatever it is are part of the primary healthcare. And then we also have psychosocial services, which are services that are provided by social workers for assistance to support difficulties in certain areas of the family. So let's say there is substance abuse, violence, mental health crisis. Those are addressed by the psychosocial team at the CLSC. CLSC also have home care services, so to support any individual that are going through a reduced autonomy, people with disabilities, chronic illnesses, decreasing autonomy as we're aging. And the team is usually consisted of, there could be a doctor, there could be nursing care provided, there's hygiene care, physiotherapy, occupational health therapy, depending on what the needs are. And then we also have community and preventative services. We're talking about public health programs, so the vaccinations I was talking about, we could have vaccinations at the CLSC, infection prevention, awareness campaigns, and there's different collaboration with schools, so the school nurse visit different schools to do vaccination, different awareness programs in the municipality as well. So how to register basically with the CLSC, it's either on their website or by contacting them by phone. Reason why I did not put any phone numbers here is because not everybody works in the lives in the West Island. Therefore, you have to contact your own CISSS to be able to register with your CLSC. They go through an assessment of needs at the intake level. So the person that received the request will see what the needs are, and depending on your request, they'll be able to guide the request to the right department. So let it be home care, let it be psychosocial services, depending on what the person needs, then it's addressed and assessed as so. And then as the situation progresses, let's say you were seen in home care for wound change, dressing changes, and then there's a situation that comes where there's a loss of autonomy that comes in that, well, we reassess the situation as it progresses. So it's not because you were initially seen for wound care or nursing care that it's only that has to be taken into consideration. So as you have a case manager, that case manager is able to reassess the needs as it progresses. And then there's also option to request a review of or a file complaint like my colleague has addressed before me here. As we know, we've been hearing over the news, yes, the Quebec population is aging and there's an increase of demand in the health and social services, but we also recognize that there is an importance in aging at home. because there's not enough resources, of course, to have everybody go to the CHSLD or a private institution. So we want to prioritize people staying at home as long as possible, depending on their healthcare condition. As we go into CLSC services for seniors, more specifically, yes, we have home nursing care. We have assistance with daily activities, so let it be help with cooking, help with bathing, help with cleaning the house, help with different activities of your daily life. We also have social services and psychological support, again, through the social worker, and different loan of medical equipment to help facilitate anyone to stay at home. Yeah. But of course, like any other services, there are limitations in the home care services, such as if the person becomes a risk to stay at home, where there's increase in falls, and then you could put yourself in danger, then these have to be reassessed because there's a dangerous situation at this point. A sign of increased loss of autonomy. Again, that could be with the falls, that could be with not being able to feed yourself properly, or risk of, putting fire in the home, depending on what's going on with the different cognition difficulties. And so we value those as risk, and we have to act accordingly. And then when that point is reached, there's a discussion with the CLSC, so the case manager, to consider alternative options for that person. So as we transition at that point with the long-term care facilities, so that the options that are going to be provided with your case manager, the case manager plays a key role in putting in that housing risk request, depending if it's going to be for a CHSLD or a private home at that point, depending on the financial means of that person. There is also the medical and psychosocial assistance that's going to be taken into consideration as well. So the admission, the request is based on availability of and the type of CHSLD that are available at the moment that the request is made as well. So basically, the CLSC is the entry point for any health and social services in the community. Okay, so we aim to promote accessibility, to prevent any health and social issues, and to also provide local support to the community at that point. Because as a primary line, we have the obligation, and we facilitate the access to a family doctor for the people that live on our territory. Now, we all know that we have a crisis with family doctors, accessibility to a family doctor right now. We don't have enough family doctors, and we appreciate the ones that are working. They're working very hard to be able to provide access, but they're limited because they already have a lot of clients. So as we're waiting for a family doctor to be able to have room to accommodate a patient, that patient has to register on the Guichet d'accès à un médecin de famille. So at the family doctor access portal, you could either do it online or by phoning your local CISSS. Every CISSS again has that portal, that access portal for a family doctor. Again, the reason why I'm not putting any phone numbers, it's depending on where you live. However, if you go online, there is only one access portal, so then it would automatically direct you to your own CISSS by entering your RAMQ. It finds your postal code, and then you go to your own CISSS. But if it's by phone, then it's a phone number for all the different CISSS in the Montreal area. And as we know that a lot of people do not have a family doctor. Since 2022, there is a new initiative that has taken place, which is the GAP, the Guichet d'accès à première ligne, which is a service for people that do not have a family doctor. So as they're waiting for a family doctor, should they have any medical need, they can phone the GAP and have an assessment done by a nurse to see what the need is. And if the need is, depending on what the need is, it could either be oriented to a family doctor, it could either be oriented to a social worker, a physiotherapist, a nurse to address the situation. Okay, and there's different trajectories based on the request. The care of that person could be taken place, but we have to remember that this is for a specific problem. So the doctor or the professional that is seeing you is only seeing you for that problem. So should you have a problem next time, you phone again the GAP, and then we also facilitate another appointment. So those are for non-urgent needs. And the reason why this service came to place is because we do want people to have access to a family doctor while they're waiting for their own family doctor, or to have access to a healthcare professional. And we also don't want people to be going to the emergency for things that could be taken care of in a clinic settings, and then removing some of the pressure that we see at the emergency very often. So how do we contact the GAP? This is a unique number. It's 811, and you do option 3. Many people already know of the 811, which is Info Santé. It's the same number, but Info Santé is option 1. So Info Santé is telehealth, if I'm not mistaken. And then option 2 is Info Social. So this is if anybody's going through like a mental health crisis, we have a social worker on call that is able to address any situation. And option 3 is the GAP. So this is for healthcare professionals to be able to assess by a healthcare professional depending on your need. So many of you remember the walk-in clinics, and the biggest issue right now is that people are saying there's no more walk-in clinics where you could have went before at 6 in the morning, waited in line, and then you knew you were going to be seen at a clinic on that date. So the walk-in clinics do not exist in the sense of a walk-in anymore. You do need an appointment for the same day. Okay, it's a same day appointment. However, you are still able to have access to a walk-in, although it's with an appointment for the same day. Okay, so they do provide accessibility for non-urgent health issues. And this walk-in is still available for people with a family doctor, same as people that do not have a family doctor, open 7 days a week. And appointments are usually available for the next day or the same day, 3 hours before the appointment, if they have an appointment available. And some of the services that are offered at a walk-in clinic, so we call it GMFR, walk-in clinic, they offer blood test. Some fees may apply because some of those walk-in clinics are private clinics. And then they also have imaging services such as x-ray if you're going for a cough and they want to do an x-ray of your lungs. They have imaging services covered by the RAMQ at that point. This is it for me. Yes. Thank you very much.